Hello everyone, I am Dr. Bindhu KS, Consultant Obstetrician and Gynecologist at Apollo Hospitals, Navi Mumbai. Today we are going to talk about postnatal care, which I think is as important as an antenatal care. Postnatal period is defined as the first 6 to 8 weeks following childbirth. Postnatal care is very important to ensure a complete and healthy recovery from childbirth. It includes both care of the mother and the baby. The care aspects include general care, then about the diet and the nutrition, exercises and sexual relations. It also includes the breastfeeding, the immunization aspects, and also the spacing between pregnancies or contraception. Now let us talk in detail about all of these. General care. General care is very important for the mother to have a complete recovery. The traditional period of rest is defined for the first 40 days of childbirth so that she gets a good physical recovery. She needs adequate rest and sleep. So it's important for the partner or the family members to look into that aspects. Her emotional needs also need to be taken care of. Now about the care of the stitches. If it's a vaginal birth, many of the women have an episiotomy or a cut down below. So the personal hygiene is very important. Keep it clean and dry. Apply ointments, and also painkillers can be taken round the clock for the first few days after childbirth. Also, she can use a cushion to sit because it might pain. You can use ice packs or also hot water baths can be given. So, it's very important that the mother should visit the doctor if she notices severe pain down below, excessive bleeding or vaginal discharge or some infection or urinary issues or even fever. Now coming to the diet and nutrition part. Diet is very important for the mother. She should have enough calories and protein in her diet because she is breastfeeding. Water intake is very important, otherwise she may land up in urine infection or she may not be able to produce enough breast milk. Diet, there is no particular taboo to any food or foodstuffs. Maybe she can take care of foods which cause gaseous upset in the stomach. She should reduce that, or even spicy or oily foods. Otherwise, all foods can be taken after delivery. And this is very important about the exercise aspect also. She can start exercising the very next day following or the very day after childbirth if she is okay. She can start with Kegel exercises, that is contracting her anal and vaginal muscles. That will help her to improve the stitch healing, and also later on it's very important for the perineum or the area or the private parts area to strengthen the muscles around that. For after cesarean also she can start with exercises. She can start with light walks. She can start stretching exercises. A full complete exercise schedule can be started after the 6 weeks following childbirth. Now coming to the sexual contact. She can have sexual contact whenever she feels comfortable. Initially little pain or little soreness can be there, that she can apply lubricants or anything, but enough contraception should be taken because spacing between pregnancies is very important. Now coming to the breastfeeding aspect. Breastfeeding is very important both for the mother and the child. So she has to take care very clearly in that proper latching methods or techniques should be there, and she can be learn about that in the antenatal period itself. She should take good care of the breast and the nipples. If she notices soreness or pain or heaviness in the breast, she can, if more milk is coming, she can express out the breast milk. She can apply creams around the nipples, or if she notices it is severe or very painful breast, then she should immediately consult the doctor. Now coming to the immunization aspects, there are some vaccinations which can be administered post-delivery too. That is, if she has not completed any vaccination schedule before pregnancy, she can complete the same. Then this rubella vaccine or the MMR vaccine can be given, the flu vaccines can be given, or even the cervical cancer vaccine. This is the best time for her to have that vaccination too. Now coming to the last but not the least, about the contraception aspect. Enough spacing between pregnancies is very important. At least 2 years gap should be there, because it ensures a complete and good recovery for the mother, and also she can take care of the first baby as well. So it's very important to consult the doctor during the first visit itself to understand the how to have proper contraception. And the postnatal visits, usually the doctor calls immediately 1 week after childbirth, 2 weeks after childbirth, and also the 6 weeks after childbirth. And there are some warning signs that she should visit the doctor whenever she has severe abdominal pain, excessive bleeding PV, or foul smelling discharge, fever, or any soreness or breast pain or tenderness. All these aspects she should visit the doctor. Thank you very much.